Sexually transmitted diseases versus bacterial vaginosis. Bacterial vaginosis is not classified as a sexually transmitted disease, but rather it is an imbalance of natural vaginal bacteria that may be linked to sexual activity. While sexually transmitted diseases or infections, like chlamydia or gonorrhea, are infections caused by external organisms passed through sex, bacterial vaginosis occurs when good bacteria decrease and harmful bacteria overgrow. Bacterial vaginosis and sexually transmitted diseases are frequently confused because they share similar symptoms, like their unusual discharge and odor. However, they have fundamentally different causes and medical implications. Cause of infection. Bacterial vaginosis is an imbalance of normal vaginal flora. It is not caused by an external germ. On the other hand, sexually transmitted diseases are caused by external bacteria, viruses, or parasites. Transmission of infection. Bacterial vaginosis is not technically sexually transmitted, but sexual activity, new or multiple partners, douching, increases the risk of imbalance. Sexually transmitted diseases are transmitted via vaginal, anal, or oral sex with an infected partner. So are both sexually contagious? You can get bacterial vaginosis even without having sexual intercourse. But STD is only a sexually contagious disease. Symptoms of disease. Bacterial vaginosis shows a thin white or grey discharge, with a distinct fishy smell, often worse after sex. This usually lacks intense itchiness. In case of sexually transmitted disease, the symptoms vary, but they often include pain during urination, abnormal bleeding, blisters, or sores. Odor of discharge. The vaginal discharge in bacterial vaginosis has a strong fishy smell, often worse after sex. In STD, the discharge has usually no distinct odor. Itching or pain. Bacterial vaginosis has minimal or no itching or pain. Sexually transmitted diseases have pelvic pain, pain during sex, or burning while peeing. Treatment. Bacterial vaginosis is treated with antibiotics, like metronidazole or Clindamycin. Treatment of sexually transmitted diseases varies by infection, including antibiotics or antivirals. Symptoms in male partners. Men cannot get BV. While they can carry the bacteria that triggers it in women, they don't experience symptoms or need treatment under standard guidelines. In contrast, male partners must be treated for most STD to prevent reinfection.